health of a society is determined by the health of the mother and her child. Almost a quarter of the global neonatal deaths occur in India, largely driven by newborn infections and/or complications in babies born too early, defined as preterm birth or birth before 37 weeks of gestation. 3.6 million of the 27 million babies born annually in India are preterm. About 3 lakh of preterm babies die soon after birth each year, contributing to 25% of the overall global preterm-related deaths. Another major concern is that many of our babies have poor growth during their antenatal period and/or are born small for their gestational age. Among the term newborns who are small for gestational age, almost two-thirds, 64%, are born in Southern Asia, representing 38.8% of all live births in that region.
The Maternal and Child Health Division at the Translational Health Science and Technology Institute is unique because it deals with problems that are driven by the societal need. Our mandate is to identify these problems and that have public health implications and find solutions that are sustainable and accessible, solutions that will make a difference. As we just saw, given the magnitude of the problem, our immediate focus is on babies at birth, the larger problem being preterm birth, and our immediate focus is on that. The reason is that despite decades of work, the problem continues to persist. There are no sustainable solutions, and it is because there are large fundamental gaps in the knowledge of this, what we call the syndrome of preterm birth. Given the way we are with being multidisciplinary, we have the opportunity of linking clinical epidemiology and mechanistic biology to find solutions in this domain.
The Maternal and Child Health has initiated a multi-institutional program, Garbhini, interdisciplinary group for advanced research on birth outcomes. It is one of the largest pregnancy cohorts established from 2015 onwards at Gurugram Civil Hospital. Women are enrolled in the cohort in early pregnancy, not later than 20 weeks of gestation, and followed at regular intervals till delivery, and has completed enrollment of 11,232 pregnant women. It is the first time that a systematic serial evaluation has been done in the country for preterm birth. Epidemiological findings of this program highlighted preterm birth rate of 13%, a stillbirth rate of 2.5%, and 40% of children as small for gestational age. The major drivers for preterm birth are exposure to ambient air pollution, maternal anemia, multiple micronutrient deficiencies, inadequate gestational weight gain, or maternal infections. Serial ultrasound scans are being done to guide clinical practice, but these scans have been used to develop AI-driven tools for accurate assessment of GA and personalized prediction of birth outcomes. These AI-based tools, after validation in diverse clinical settings, will form a package of interventions to be applied at various levels of antenatal care. These efforts have contributed immensely to capacity building of Indian scientists in the area of artificial intelligence for healthcare. Multiple blood and vaginal samples are collected across pregnancy to identify nutritional and metabolic signatures associated with PTB. Multi-omics platform have been established to develop prediction and diagnostic biomarkers as triaging tools for appropriate and timely clinical decision in varied clinical settings. Another important objective is to augment infrastructure for clinical research to create national resources by establishing clinical research units in partner hospitals, data management centers, and a biorepository for future research in the country. The biorepository at THSTI houses over 700,000 biospecimens and more than 400,000 serial ultrasound images of the cohort participants. Garbhini is unique because THSTI has partnered with National Institute of Biomedical Genomics, NIBMG, Kalyani, Regional Centre for Biotechnology RCB, Faridabad, Gurugram Civil Hospital GCH, All India Institute of Medical Sciences AIMS, Tertiary Care Hospitals Safdarjung Hospital and Maulana Azad Medical College MAMC, New Delhi as partners. In India, more than a quarter of the annual 1 million neonatal deaths result from serious infections like pneumonia, sepsis and meningitis, while appropriate antibiotics are available in many hospitals in low and middle-income countries. Second-line antibiotics are either unavailable or expensive in peripheral health facilities. So it is important to develop inexpensive, effective and accessible interventions that can be added to standard therapy for severe infections to improve treatment outcome and reduce case fatality.
The focus of the Maternal and Child Health Department has been to find solutions for early life morbidity and mortality. And we have a two-pronged approach. One of them is where we do analytical observation studies, which is for discovery research, which is for developing interventions, algorithms for different causes of early life morbidity and mortality. And the other approach is more downstream, where we do randomized control trials and where we are evaluating interventions to either prevent preterm birth, treat the complications due to preterm birth, or to find solutions for sepsis that happens and is a major contributor of death in the neonatal period. So one of the trials that we are doing is a large randomized controlled trial where we are investigating the role of zinc given as an adjunct to routine antimicrobial therapy in small infants 2 to 59 days of age with severe infection.
The results from Garbhini's teamwork have marked important milestones. Oral zinc administered as adjunct to standard therapy in young infants with clinical sepsis can reduce case fatality. The results will help to inform and guide health policy makers towards reducing young infant sepsis. Also, as part of a global team effort, we have highlighted the life-saving importance of immediate kangaroo mother care for low birth weight babies, which has the potential to save up to 150,000 lives a year across the world. About 25% reduction in neonatal deaths was observed in newborns with birth weight 1 to less than 1.8 kgs. These findings will have crucial contribution in updating WHO recommendations on interventions to improve preterm birth outcomes.